osteoarthritis, but did you realize that there are actually over 100 different types of arthritis? Dr. Andrew McMarlin from Winning Health joining us with some suggestions on helping those who are suffering from arthritis. Of course, you're a doctor with the Olympians, pro athletes, children, as well as adults. Do you see arthritis more or less in pro individuals that are professional athletes?
You do, and unfortunately you see them at a pretty young age. When someone's been competing at a high level as children, teenagers, you start seeing the ACL tears and meniscus tears and other types of joint injuries as a teenager. So starting in the late 20s, early 30s, I see a lot of patients who've already developed arthritis at that age.
Tell us exactly what is arthritis.
So the definition for arthritis is arth is joint and itis is the inflammation and pain. So basically anything that has a pain in the joint is the definition is arthritis. And there's over 100 different causes for it, and everyone has a different reason for developing it, and so each one has a different evaluation and treatment.
As my right knee does all the time.
Yeah.
But I used to run a lot, do more walking and biking now, but still it has a tendency to swell a little bit, ache and so forth, a little bit of discomfort at night sometimes. When you're treating young adults, when you're treating children, especially those who are very athletic, maybe they're gymnasts, so forth, are they sometimes not stretching enough that they can get that injury, or it's just going to come anyway?
Well, it can be a part of it, being unbalanced or not being stretched, but honestly, stretching before you exercise can cause more injuries than
really? Okay.
The recommendation now is really to stretch afterwards, just make sure you're appropriately warmed up. But there are, because of the different causes for what's going on with your knee, if you haven't had success with some anti-inflammatories like ibuprofen and even a couple joint injections, getting a real thorough evaluation can be really instrumental in making sure that you maintain function.
Evaluation, maybe an MRI
well,
to see what's going on internally?
You know, and there are, an MRI shouldn't be the first answer you get from your doc. So you want someone who's going to take the time to do a really thorough evaluation. There's actually a number of things on physical exam that are more accurate than an MRI for diagnosing a condition. So when you get an MRI, you'll see a bunch of different things in there that may have nothing to do with what's going on with your knee.
What can we do about chronic arthritis and osteoarthritis as well? What can you as a doctor, once you see this, once you know that's in the patient, what can you do about it?
Well, there are a host of different therapies that can be beneficial, from different types of self-therapies, home physical therapies. There are a lot of new medications. There's also many new procedures that don't include replacing the joint.
We'll get to that in just a moment.
Okay. Yeah. So there are guided joint injections, and as well, so using steroids or cartilage gels, but also platelet-rich plasma. So there are a lot of things out there that are keeping people from the arthritis from progressing and keeping you functional and enabling people to do what they like to do.
Talk about the injections. Sometimes a steroid type of injection is good in a certain area.
It can be, but frequently I'll hear someone come in and say, I've had those already and it didn't work for me. And unfortunately, most injections that are done without guidance actually are not going into your joint capsule. And there was a big study that came out a few years ago, a large orthopedic group did it, that showed that only approximately 40% of injections are actually going into the joint capsule to do any good. And so
going to exactly the place where it's supposed to be done.
Exactly. And so, because there are...
That's kind of the fault of the doctor then, in a sense, isn't it?
You know, it is. We're definitely guilty of that. And before I got a lot of extra training on ultrasound guidance, I'm sure I was guilty of that as well. But one interesting commentary, I went to a conference where one of the authors of the study was describing it, and this is a hit on all of us as docs, is that 100% of even though only 40% of the injections were actually going inside the joint capsule, 100% of the surgeons felt that 100% of the time their injection was going into the right spot. But honestly, unfortunately, most of them are not.
Injections, ibuprofen, both of those don't work. Let's talk about replacement, maybe elbow replacement, maybe hip replacement, maybe knee replacement. What is the most common replacement that you see?
So hip and knees are the most common replacements, but most of the time I've seen they're unnecessary. There are so many different types of therapies out there.
That's good to hear.
Particularly as a 50, 60, 65-year-old, you don't want to, if you live to be 65 and you're otherwise healthy, your life expectancy is in the 90s. And so if you're,
there we go.
So of course, so you're
Boom!
Yeah, so you're 39. So
This is my new doctor, by the way.
you get your hip replaced. You can expect to have that redone a number of times, and every time you have all the risks that are incumbent with surgery. And so, I don't want to overstress the risks, but this is something that I'm passionate about. I had a favorite former landlord and friend of mine recently passed away. Otherwise healthy man who wanted to stay active, got a hip replacement, and a week later he died from his from an infection inside the joint.
Wow.
So it's something that you should not take lightly, especially because there are so many other good therapies that should be very much the last. The last response would be to get the joint replaced.
A lot of great education right here today. Thank you very much, Doctor.
Very
Appreciate
nice
it.
to see you.
All right, we've got more coming up now. Let's toss it over to Aaron.